these tools don't change that. In other words, the legal responsibility is still on you to make the detection, to make the diagnoses as the radiologist. So by enhanced detection, again, just to hammer this home, we're referring to enhanced detection by the radiologists that benefit from the awareness provided by these triage and notification AI tools. All right, let's dive into our rib fracture model again, and we can look at the impact on the radiologist with these AI tools versus the radiologist alone. So let's look here. So we have about 6,000 patients in our data set. Our radiologist found 114 rib fractures. The AI found 173, and importantly, 69 of those that the AI found were not seen by our radiologist without the AI. And so you can express this as an enhanced detection rate in two different ways. You can talk about a relative boost to detection, which would be 69 over 114, or a 61% boost to, on a relative basis. You can also express this as an absolute enhanced detection rate, which is 69 over, this 5,800 patients or so. And that's, a 1.2% enhanced detection rate.